So guys, very good evening to all. I hope I am clearly audible and visible to everyone. Very good evening to all. Greetings to all. And in my way of greeting, Assalamu alaikum, Shashriyakal, Ram Ram, Namaskaram, Vanakkam to everyone. So this is a session to cover my subject, forensic medicine and toxicology, so as to solve all our 12 to 13 questions which will be coming from my subject, and I will make it sure that you don't make those questions wrong. So it's a matter of about 50 marks. So we'll be paying full concentration with full attention. We'll be trying to grasp whatever basics things we need to understand in the class. You'll be making notes with me throughout the sessions. If at all some images PDF are needed, that I will be sharing you in your concerned Telegram group. Prepare to clear the doubts. Clear? As far as new legal sections are concerned, I have already prepared a comparative PDF where IPC sections can be compared with the Bhatia Nyaya Samhita sections and all those things, which we will cover from chapter to chapter accordingly. And I will put a tick mark in that PDF, and in the end, I will share the annotated one with you all. Clear? I hope there is no confusion so as to how we are going to move ahead. Now, starting with today's session. This is a session targeted for intern group of students or for students who are going to give upcoming exams. So I'll be covering the basic things as well as the whole thorough knowledge of the chapters. Okay. So starting with the basics. The questions which come from the basics part are mainly related to the understanding of the subject. So let us try to understand the subject and let us start with our session. So in relation to basics, first thing which comes into mind is the name of the subject itself. So as to what do you mean by forensic medicine? And as a doctor, we should be able to answer that yes, this is nothing but application of medical science knowledge in law. This is application of medicine in law. Now, as a doctor, suppose a policeman brings a case to you and he is of the opinion, ki sir, this person was found dead on the roadside. So, a policeman has brought a dead case to you. And what is he asking to you? Ki sir, whether this death is natural or unnatural. So, as doctors, we should be aware of these two types of deaths from where our MCQs are also framed. So one of the causes of natural cause of death can be coronary artery disease cases. Coronary artery disease cases. In unnatural scenarios, the death can be accidental. We all know the death can be suicidal also. And death can be homicidal also. Homicide means to kill a person by any means. Killing of a person by any means is homicide, unless proved otherwise. Now, coming to this natural cause of death. Now, whenever a person is brought dead in hospital, what is that registered medical practitioner? You all after internship will become RMPs. Okay, once your degree is registered in your respective state medical councils. Okay. Now, with respect to the natural cause of death, what will that doctor write in that cause of death is unknown? Okay, so now the body will be sent to mortuary for autopsy if a person is declared brought dead in casualty. Now during autopsy, what is the purpose of conducting autopsy? The purpose of conducting autopsy, which is also said to be postmortem dissection of a dead body. Post means after, mortem means death. Postmortem always means after death. Antemortem means, anti means before, and mortem means death, before death. So these two words should be very clear. Postmortem means after death. So autopsy is basically postmortem dissection of a dead body, in which I will be utilizing some incisions, I will be using some dissection techniques, and I will frame MCQs. Back to back 2 questions in your NEET PG 2023 from postmortem dissection techniques, isn't it? And those 4 techniques, they are bonus techniques. 2 questions, 8 marks, full throttle, and you will be very happy when you will solve 2 questions with full confidence that yes, the methods are not going to change. They will remain for next 6 months, 1 year or 2 years. The methods will remain same. So that is why I say this is a very interesting subject. Why? Because it will secure your 50 marks in your exams. Now suppose that fellow who was a brought dead case, Now, during autopsy, we remove the organs one by one, and that technique of post-mortem dissection is called as, anyone? That is called Virchow's technique. If I take out the organs one by one, right, right lung, left lung, heart, liver, spleen, kidneys. If I am removing the organs one by one, that is Virchow's technique. So by utilizing Virchow's technique, I have taken out heart from the thoracic cavity. Now, I will keep the heart in anatomical position and I will look at the coronaries, LAD, LCX and RCA. I will take a scalpel blade and I will dissect the coronaries at regular intervals like over here. You can see the sections of coronaries. Now, over here, what we can see is that the lumen of the coronary, LAD, in particular has pinpointed, means the lumen has obstructed. And that obstruction has been caused due to atherosclerotic plaque. Means I should have knowledge of pathology subject, atherosclerosis and all. I should have knowledge of anatomy so as to where LAD is. Otherwise, what I will be dissecting? So I should have knowledge of LAD course, LCX, where I will find LCX, where I will find RC, and then I will dissect the coronaries. And after seeing this finding, what I will write? That LAD is more than 95% blocked. What will I write in my postmortem report or autopsy report? Cause of death is coronary artery disease. If the policeman asks me, sir, is it natural or unnatural? Yes, obviously it is, but natural. Okay. So this is FM. Application of my medical science knowledge means medical science subjects in the administration of justice to a dead person. And this knowledge will be utilized in living person also. So as we move along with our class, we will see the utilization of this subject. So this comes your coronary artery disease cases. This is application of medicine in law. Now in relation to accidental death. So basically with my medical science knowledge, I will be able to estimate my COD. COD throughout my sessions will mean cause of death estimation. COD for cause of death. Then with the help of injuries chapter, with the help of medical science knowledge, I will be able to derive my cause of death. Then with the help of postmortem changes, we estimate our time since death. That is another purpose of conducting autopsy of a dead body. And this autopsy also helps in identification of unknown dead bodies or unknown bones. So it will be utilized for identification. We do autopsies of unknown dead bodies. Like when do you declare a dead body unknown? That is a very old question of all India exams. So according to Delhi Anatomy Act, if the dead body, DB for dead body, is not identified for 48 hours. Now what is the work of the policeman? Now he will write in the column where name of the deceased is entered. So there he will write this word unknown. So this tag is given after a period of about 48 hours when the police is searching for the whereabouts of the person. After that, I will be doing the autopsy of this unknown dead body. So we help the policeman in identification of unknown dead bodies as well as unknown bones. And that identification of unknown bones, we will be covering in our identification chapter. So basically these three important chapters, injuries knowledge, then the knowledge of postmortem changes, and the knowledge of identification is going to serve the purpose of autopsy. And that is why these are most important chapters of FMT subject, which we will be covering one by one. Now coming to unnatural deaths. Now coming to unnatural deaths. If death is accidental, what we should remember in relation to accidental deaths? Let us remember one very important example of fall from height cases. Repeat INI CT exam question. What will be the scenario in a fall from height case? What is correct about fall from height case? So if I say that suppose this is the fellow and he has fallen from 3rd floor. So even a general person who is not a medico will tell that he will have lots of injuries. He can have lots of fractures. And that general thing, logical thing we have to apply. That yes, if a person is falling from a great height and he lands on his feet, what will happen initially? Fracture of foot bones. Then suppose if he is falling from a great height, his pressure, the transmitted pressure will run upwards along the body and mainly along the bones and mainly along the vertebral columns. So due to this transmitted force of impact, he can get fractures or injuries over thoracolumbar vertebral regions. And supposing this pressure was very large, it will further transmit upwards to the base of the skull where lies our foramen magnum and can cause fracture around foramen magnum. And what is this fracture called as? In one word, this fracture, because the foramen magnum is in the shape of a ring, this fracture is called ring fracture. Easy. So this typical presentation was one of the repeat questions. So remember, and along with this, remember the person will have multiple injuries. Which injuries? Obviously blunt weapon injuries or blunt force impact injuries. Will he have sharp weapon injuries? No, he is falling from a great height. He will have blunt injuries due to that blunt impact. Which are the important blunt injuries? Abrasions, bruises and lacerations. Will they be seen in cases of fall from height? Yes. Will they be seen in cases of road traffic accidents? Recent INI CT exam question. What was asked? That in a case of road traffic accident, which of the following injuries is not possible? But which are possible? Blunt injuries. Which are the important blunt injuries? Abrasions, bruises and laceration. They are possible. Any variety of laceration, any variety of bruise, any variety of abrasion is possible. All depends on the mechanism of the injury. So in road traffic accidents, we can get variety of blunt injuries. But will you get incised wounds? Will you get chop wounds? Answer is no. In fall from height and RTA cases. So this logical question was recently asked. Now coming to suicidal deaths. There are multiple one-liner questions. So let us consolidate them together. In relation to suicidal deaths, one of the questions is, what is the most common cause of suicide overall? Karan. What is the reason? Reason is depression. And keeping yourself happy will make you non-depressive person in your life. Always try to be happy. Always keep that smile on your face. In whatever situation you are, you might smile with one good reason. You might have 99 reasons to be depressed, but that one reason should keep that smile on your face. That is the motive to live a good and healthy life. So what is the most common cause of suicide overall? Depression. What is the most common method? Most common method of suicide in India is hanging. Then they also asked very old questions. Ideal suicidal poison. The list consists of few poisons. Single one to be remembered as cyanide. Then most commonly used suicidal poison overall. Overall in our country, India is agricultural based country. So farmers use pesticides, mainly OPC pesticides like malathion, parathion. So yes, that is why our answer becomes OPC pesticides, organophosphorus compounds. Then, if the same question is asked, most commonly used suicidal poison in relation to North Indian population or North Indian regions, or they are particularly written in Delhi region, which is the most commonly used suicidal poison. So this North India word will shift your answer to Selphos. This is based on National Crime Record Bureau data, NCRB data. Okay. And still the data goes with aluminum phosphide, which is commonly called as Selphos. Details of all these poisons we will cover in toxicology on last time. So these are some important things in relation to suicidal deaths. Then coming to homicides. H for homicide. In a similar way, let us write few important one-liners here, which is the ideal homicidal poison. There are few poisons which are classified in this list. If you at all have to remember one, so remember ideal mein thallium, and which is overall the most commonly used homicidal poison. Remember, elder brother of thallium, that is arsenic. They almost behave in a similar way. Their few features are similar to each other. We will see that in toxicology, but their treatment is different. Arsenic treatment goes with British anti-Lewisite, but thallium treatment goes with Prussian blue. But they show some common features like aldrich meseline, alopecia, asymmetrical sensory motor neuropathy. So this is going to cover wrap up our first definition, that is of FM. Now come to second definition. The second definition is of medical jurisprudence. Now, what do you mean by medical jurisprudence? Is application of law in medicine. Jurisprudence word literal meaning is law, kanun. And medical jurisprudence means application of law in medicine. Now, as doctors, we should have knowledge of certain laws, like, for example, MTP Act. And see, this topic I usually cover in all my classes within first 10 to 20 minutes and back to back. 3 questions in last session of FMG exams, 3 questions in recent session of FMG exams. And yes, recent acts and recent changes, they become important areas of questions. And this is one prime example, because every doctor should be aware of the new changes, na? Otherwise you will commit a mistake in the absence of knowledge. So that is why they will keep on asking questions. Even in PG exams, it will be asked. So our target should be to have a mastery over those topics from where I know that questions will be asked. But our smart work will be, we will not touch those topics which are useless, from where till date no question has been asked. So we will be ruling out those things. You will be getting your notes which will be most refined ones. What is your work to do? You have to revise them again and again. And make it sure that you don't make a mistake from those notes areas. And you will secure your 50 marks in your exams. Okay. Now coming to MTP Act 2021. Full name you all must be knowing, medical termination of pregnancy done by doctors. So this is legally allowed. So whose consent is necessary for medical termination of pregnancy? The consent is needed only of a female. But the age of the female should be more than 18 years old. Marriage has no relation with MTP. शादी का कोई लेना देना नहीं. Marriage has no relation with medical termination of pregnancy. What about if the female is less than 18? Take the consent from guardians. Call the guardian. Is husband the guardian of their spouse? We are not guardians of our spouse. We are partners. Marriage is a legal contract between two people which implies sexual union. So as far as marriage is concerned, that is a legal contract between two people of almost when they complete the age of 18 years in females and 21 years in males. So that is why the consent has to be taken from a guardian, because husband role is not there in MTP. In fact, the husband word is not there. Instead of husband, what word is there in the MTP Act? Partner word. So let us see the indications. Indications under which MTP is allowed. And you should read a true thing, accurate thing, and you will be getting the most accurate thing from the Act. Act needs to be read very carefully, because there are lines of the Acts now which are very twisted. So you are getting the most refined notes and most accurate things. So what are the important indications for MTP? First one, if the pregnancy is up to 20 weeks, one doctor opinion is sufficient to get MTP done. On two basic indications, one is if there is any serious risk to female or fetus. Any medical, surgical, serious risk is involved with the fetus or with the female in relation to chorionic villus sampling or amniocentesis. You find some findings. Yes, now MTP is allowed. Then, if pregnancy has occurred due to contraceptive failure either by female or her partner, contraceptive failure by female or her partner. This word was not there earlier in our Act. Now male contraceptive failure is also covered, but this contraceptive failure is very, very clearly written in our MTP Act, which has to be read very carefully, those twisted lines. You cannot say that this is not written. This is clearly mentioned. If I go into details now, it is written in explanation subsection 3. The section 3 explanation, clearly it is written that pregnancy due to contraceptive failure is an indication only up to 20 weeks where one doctor opinion is sufficient. This was the gist of one of the recent FMG exam questions. This thing was asked. Then coming to the second broad indication, if pregnancy is between 20 to 24 weeks, how many doctors opinion is needed? Answer is 2. 2 doctor opinion is now sufficient. Now for which indications? Now after formulating MTP Act 2021, government always makes the rules how an act will be implemented. Later on, they included some special categories of females in which MTP can be done even till 24 weeks on the opinion of 2 doctors. What are those special categories of females? So first indication we can write any serious risk to fetus, that is still here. But with respect to females, they have mentioned some special category which we should remember thoroughly. यहाँ पर हमें छोड़ना नहीं है. We don't need to leave any category because these categories will be utilized to create options. This I have been telling for last 2 years, right, since 2021 when the act was made, and you are seeing the questions are in the similar way. So what is that special category of females in which MTP can be done till 24 weeks? If the female is a minor, means less than 18, but whose consent will be needed for doing the MTP? Guardian's consent. If the female was having any physical disability, that is also an indication for up to 24 weeks. If the female was having any mental illness, in which we read our psychotic and neurotic illnesses in psychiatry, na? So mental illnesses are covered. For PG exams, what becomes very important is they can create a tough question out of it. In mental illnesses, we have read na Mental Health Act, which I cover in forensic secretary part. So Mental Health Act covers mental illnesses, excluding mental retardation. It does not cover mentally retarded females. Mental Health Act has been prepared to safeguard the rights of a mentally ill person. Which mental illnesses? Psychotic and neurotic illnesses. But MTP Act also covers mentally retarded females. So they can create that there is a female whose IQ, based on IQ levels, they can create an integrated question from here. IQ is calculated na, and that is how we categorize profound, severe, the categories of mental retardation. So mentally retarded females are also covered. This will become future exam questions for sure. Then in relation to females, also remember, if this pregnancy has occurred due to, they have clearly written 3 conditions. What are the 3 conditions? If it has occurred due to rape offense, or if it has occurred due to any sexual assault, or if pregnancy is the result of sexual intercourse between close relatives, in one word called as incest. So yes, this is also clearly written. They can create a question that there are known relatives, they have married, now the pregnancy is of 22 weeks. MTP can be done on the opinion of 2 doctors. This is how questions will be twisted. And you know the way also how the questions will be framed. Then in relation to any change in marital status of the female during course of pregnancy. During the course of pregnancy, what is discovered is now the female has become either a widow or divorce has occurred. So widowhood and divorcehood, they have categorically been mentioned as change in marital status. Now MTP can be done up to 24 weeks. And last thing to be remembered, in relation to any disaster or emergency declared from the government side, again MTP is allowed because mainly in disaster and emergencies what is noted is people suffer severe economic losses. So basically economical loss is also covered in relation to MTP for up to 24 weeks. Now coming to the last and the third broad indication. The third broad indication is if this pregnancy is beyond 24 weeks, can you go ahead with doing MTP? Answer is yes. But now the opinion will be needed of a medical board. Opinion will be needed. And for which indication? There is only one single indication for this duration of pregnancy. Upper limit is not mentioned. They can create a question that pregnancy can be terminated according to MTP till what age? 20 weeks, 24 weeks, at any age. At any age will be your best answer. At any age of gestation, now MTP can be done. But for which indication? Any serious risk to fetus. And what they have written in the act actually is serious abnormality in the fetus. We are writing a simple word. The more simpler it is now, the better it is to recall. So if there is any serious risk to fetus, yes, MTP can be done even beyond 24 weeks at any age. On the opinion of a medical board, which will be constituted by 3 department people. One should be a obs-gynae practitioner, another person should be from pediatrics department, and third person should be either a radiologist or a sonologist. And lastly, they have also entered one line that any other member, as decided by the government from time to time, they can be included. It's not that people will be only from these 3 departments. If the government makes new rules in MTP Act, with relation to MTP Act, any other member can be included from government side on the directions of the government. Now, these are the indications, simple indications for up to 20, 20 to 24, beyond 24, there is only one single indication. Then we should also remember that any doctor, there are 4 categories of doctors which we will be covering who can do MTP. So let us first cover who can do MTP. And then we will come to some basic things. Who can do MTP in India? Which doctors are eligible? The first group of doctors is any MD degree holder or diploma holder in obs-gynae department. MD or DGO in obs-gynae. Then second group of doctors is any registered medical practitioner who has taken 6 month, M for month, house surgeonship experience, which is mainly taken in government institutions. So house surgeonship experience has been mentioned to as 6 months, or in the absence of house surgeonship experience, 1 year experience in any medical establishment, be it a nursing home, be it a clinic. So 1 year experience is also allowed. Either of the two. Then third category of doctors who can do MTP is any RMP who has assisted a obs-gynae practitioner in 25 MTPs. And it has been certified by the obs-gynae practitioner that so-and-so doctor out of 25, out of this 25, 5 MTPs were done independently by himself or herself. So they are also allowed to do MTP. 25 out of which 5 should have been done without the assistance. And this will be certified by the obs-gynae practitioner. And last category of doctors is any RMP with 3 or more than 3 month experience, which can be availed in any medical establishment in obs-gynae department, or any RMP who has conducted 10 MTPs under the guidance or supervision of obs-gynae practitioner. He has conducted 10 MTPs by medical methods of abortion by prescribing drugs like mifepristone and misoprostol combination. Day 1, day 3, we give this combination. That is the medical method of abortion. So this is a new category which has been added. Why the new category was added? Why the eligibility criteria is decreased now? Because government has increased the scope of MTP. Now more and more couples will come with a history that we were using condoms, but rupture of condoms has occurred. Now the doctor who is listening to this version of the couple was not present at the crime scene. He is totally unaware so as to what could have occurred. Not crime scene, the scene of coitus. So now he will have to believe on the version of the couple. They will give in written that yes, rupture of condoms has occurred and the doctor is well secured. he or she can go ahead with MTP. So more and more couples will be coming for MTPs. More and more doctors will be needed. So they have decreased the eligibility basically. How this will be used to create new question? Now I will write a question line that pregnancy is up to 9 weeks. Which of the following doctors can go ahead with conduction of MTP? What will be your answer? For up to 9 weeks. Either of the four. Either of the four means 1, 2, 3 and 4, which we have written like this now, 1, 2, 3 and 4. So either of the four, they are allowed to do MTP. But for any pregnancy beyond 9 weeks to 12 weeks, who can do MTP in India? Who are allowed to do MTP? Only 1, 2 and 3. That will give birth to the new question. Which are the doctors which can do MTP only up to 9 weeks? These two categories. 10 MTP experience by medical methods or 3 or more than 3 month experience of assisting obs-gynae practitioner with MTPs. For any pregnancy beyond 12 weeks, who can do MTP in India? Only 1 and 2. This will be asked in future PG exams or FMG exams. This is the area which they have not asked, but they will be asking because this was the thing which was added in the new MTP rules along with the special category of the females. I hope till here the things are simple and clear. Now coming to some additional facts, factual informations. Whosoever is conducting MTP, they have to maintain a MTP register. How this MTP register has to be maintained? With full confidentiality. How is the confidentiality of the patient is preserved? Every patient is given a number. Patient name is not entered in the medical records. This is one way of providing confidentiality in relation to MTPs. Second mechanism is everything is present in a sealed envelope. And the data, monthly data of MTPs is to be shared on a monthly basis to Director of Health Services. DHS means Director of Health Services. So MTP data has to be sent on a monthly basis that 25 MTPs were conducted in my clinic. This report has to be sent by the doctor to Director of Health Services in a sealed envelope where in the medical records the patient would have been given a number. So this is what we doctors should know. These are all the important ingredients of MTP Act, which is essential for every medico for their exams as well as for their medical science practice. This is also important for obs-gynae practitioners too. I hope there is no query in this act. So this covers our second definition, that is of medical jurisprudence. Now come to third definition. Come to third definition, that is of medical ethics. Medical ethics. Ethics is defined as moral principles or courtesy. Courtesy one is medical etiquettes. Courtesy वाले को बोलते हैं medical etiquettes. Medical ethics is defined as set of moral principles. This is one silly mistake area. हम कंफ्यूज हो जाते हैं, वी गेट कंफ्यूज कि एथिक्स क्या होता था. एथिक्स क्या होता है? मॉरल प्रिंसिपल्स, मॉरल साइंस, द सब्जेक्ट विच इज मैंडेटरी टिल 6th क्लास, है ना, उसके बाद ऑप्शनल हो जाता है. सो दैट थिंग, सेट ऑफ मॉरल प्रिंसिपल्स which will be guiding, this will be guiding 3 types of relationships, mainly doctor-doctor, doctor-patient and doctor-state relationship. Now one query should come to your mind very quickly. Sir, doctor-doctor is understood, doctor-patient is understood. What do you mean by doctor-state relationship? Doctor-state relationship simply means whenever law enforcing authorities they bring a case to us, we cannot say कि इसको लेके जाओ, We have to look after the case. If a person is brought dead in hospital, it is our duty to send the dead body after cutting the MLC in casualty. We have to send the dead body to mortuary. This is our medico-legal duty. This is our moral principles towards law enforcing authorities like policemen. I hope you understood the meaning now. So moral principles should be followed by a doctor with another doctor, with their patients, and with the law enforcing authorities too. Who tells us about all these facts? This thing is told to us by our NMC, National Medical Commission. So they have prepared the list of medical ethical things. They have also prepared a wide list of unethical things, that these things will be unethical on parts of every doctor. What are the important unethical acts? What are the important unethical acts? Now, this is another silly mistake area. Synonym of unethical acts. So let us write that thing. Unethical act is also referred to as infamous conduct by a doctor. Paryayavachi. Synonym in Hindi called as Paryayavachi. So this is also sometimes referred to as, synonym way as professional misconduct. How do we make this silly mistake? We remember this as professional negligence. Negligence is a different topic which we will cover today. But unethical acts is professional misconduct, not professional medical negligence. Okay? So keep it very simple and clear. Now, what are the important unethical acts from where our MCQs are framed? This list consists of 6 A's, which every doctor should remember, that during the course of treatment of a patient, you should not be in an alcoholic state. Alcohol becomes one of the A's. You should not be under any addiction, that you have consumed ganja and you are treating your patients. Now, ganja is a narcotic drug of abuse. If you are found consuming ganja, again it is a punishable offense according to NDPS Act. You will get punishment according to NDPS Act by our court of laws. That will be a judicial punishment. But with regards to this medical ethics, the state medical council will take a disciplinary action against the doctor by either giving warning to a doctor or by doing penal erasure of the name of the doctor, which we will see. So alcohol and addiction, they are not to be done during the course of treatment of your patients. Then comes A for advertisement. Doctors can advertise, but with respect to opening of new nursing home and clinics, advertisement guidelines have been given by NMC. So just follow those guidelines. So it can be done in a prescribed manner. Then another A for association. Association simply means covering of unqualified person by a doctor. A doctor has covered his compounder that you give the final skin stitches to save his time for another operation. This is not to be done. Covering of unqualified person to do your job is unethical. Then another A for adultery. Adultery previously was an offense, but right now it is not any offense in law. Adultery used to be written as a sexual intercourse by a married person with someone else's wife without the consent of the husband. So this was previously an offense under 497 IPC, but right now it is not an offense in law. But for we doctors, it will become unethical because NMC has still written adultery is unethical on part of we doctors. So sexual intercourse by a married person with someone else's wife without the consent of husband of that lady. Then comes A for abortion. We have just now read now abortions are medically allowed when the indications are fulfilled. So that will be a legal abortion. MTP in another word can be called as legal abortion. But abortions can be illegal also when you are not following the MTP Act guidelines. Illegal abortions are also called criminal abortions. Means you have done a criminal act. You have done a crime in law. Now the courts will give you judicial punishment. State Medical Council will give you their disciplinary powers. They can utilize those powers to punish a doctor. So for illegal abortions, previously we used to read 312 to 316 IPCs. Parallelly, what you can do is you can remember these sections parallelly. This is the new legal sections comparative table, which I will be sharing, the annotated one, on the last day once we are done with the marking that these are the important sections which we should remember in a comparative way. So these are the sections in relation to criminal abortions which we know. 312 deals with abortion with consent. 313 abortion without consent. Which type of abortion? Criminal. If the death of the female occurs during abortion, that was your NEET PG 2023 question. Okay. Answer was 314. Now the numbers will change. So 88 to 92, they now deal with criminal abortions instead of 312 to 316 IPCs. The new changes has not been notified by the government yet, but you never know. Government will notify it tomorrow. So why to wait for the government's notification? The bill has been signed by the president. In the same state, it will be notified by the government. So our smart work at least should be to get prepared for the worst, isn't it? So just look at them. Don't try to put any stress over your brain that I have to mug the numbers. If you keep on looking the numbers constantly, it will go into your brain. We medicos have very good ratification power. So this is like basically bland ratification, but with some smart work. That if I am remembering 312 to 316 side by side, 88 to 92, this is the smart work. Okay. So all these sections have been channelized and compared by me like this. Wherever required, now I will put a tick mark, and it is those tick marks which you have to read. Now 91 and 92, what they deal with? They deal with live births. 91 or 315 IPC they deal with. So this is basically Bharatiya Nyaya Samhita. The IPCs have been replaced by Bharatiya Nyaya Sanhita. Then 92 section of BNS deals with death of quick unborn child while trying to kill mother. Intention was to kill the mother, but a quickened child death has occurred. What do you mean by quickening? Movement of fetal body parts perceived by the female. Active fetal movements perceived by the female, which is perceived between around 18 weeks of pregnancy. 16 to 20 weeks is the range. Around 18 weeks, the female has they perceive the active fetal movements. So if the child has achieved the age of quickening and he has died while the intention was to kill the mother, 316 IPCs or 92 BNS will be applicable. Clear? So these are our 6 A's: alcohol, addiction, advertisement, association, adultery, and abortion. Other than 6 A's. Also remember, medical dichotomy is also unethical. What do you mean by medical dichotomy? Medical dichotomy. Medical dichotomy means fee splitting. Which is done between doctors. B/W means between doctors. And this fee splitting is done usually by unwanted referrals. Unwanted referrals. Unwanted referrals. This question came in FMG exams. There is a physician who has sent one patient to one of the friends. From his friend's clinic, someone comes with a thank you letter along with a money packet. What is correct about this? The answer was medical dichotomy. Is it unethical? Yes. Then also remember, issuing of false certificate by we doctors is also unethical. Which false certificate we doctors can provide to gain money? False birth certificate, death certificate, disability certificate, sickness certificate. Should you do those things? Answer is no, never ever. Issuing of false certificate is unethical. And it is a punishable offense in law also. So all these important unethical acts along with 6 A's, remember, dichotomy and issuing of false certification by any doctor is unethical. Now, once a complaint is made to the state medical council, once they receive a complaint against the doctor, now punishment is prescribed for unethical acts. Now, what are the punishment for unethical acts done by a doctor? This punishment will consist of punishment either by a medical body, that is State Medical Council, SMC for State Medical Council, and this can be by courts also, but courts are not medical bodies, they are judicial bodies. Courts have their different powers, power of fine, power of imprisonment, but medical body has not got judicial powers, but they have been given powers like you can give warning to a doctor if the offense was mild, or you can erase the name of the doctor from the state medical register called as penal eraser, which can be temporary like for 3 years, 5 years, or which can be permanent, lifelong. And this permanent one in one word is called as professional death sentence. Professionally, the doctor degree is gone, his license to practice is gone, his MBBS degree is gone. So this is called as professional death sentence, permanent penal eraser. Clear? So this completes our ethics area. One more thing, one more important thing which has been updated since 2019. Like suppose State Medical Council has taken an action of temporary penal eraser for 2 years to be given to a doctor, but the doctor thinks that he is innocent, and in reality he is innocent, but somehow the evidences were falsely proved, or somehow the State Medical Council has taken a decision. Now he can appeal. So appeal against State Medical Council decision will be made by the doctor to which of the following? This is itself a repeat question, and earlier the answer to this question used to be Central Health Ministry, but since 2019 the answer has changed to EMRB. The full form of EMRB is one of the boards under NMC called as Ethics and Medical Registration Board. So they will now look after the appeal cases. If the matter is settled at EMRB, well and good. If it is not settled, now EMRB will hand over the file to NMC board, and a new board of members will look after the case, and now they will take the final decision. So always read the lines of the question very carefully, ki what is being asked. Whether they are asking about appeals are made to which of the following, then goes with EMRB, or the question has been twisted in a way that they are basically asking this final decision. In relation to punishment for unethical act, a doctor has gone to EMRB but his matter is not settled. Who will take the final decision now? Now your answer will shift to NMC. So accordingly pick your answer. So we have written the keywords. So this completes our ethical areas. This is the third important definition. The fourth important definition being medical etiquettes. Now etiquettes in one word is referred to as laws of courtesy which should be there between doctors. Your ex-girlfriend has come with their parents. You are charging double from your ex-girlfriend as compared to your original fees. You can, but this is not following the courtesy. Courtesy will be you are not charging your, at least the medical fraternity people. But there are many doctors who don't follow courtesy. It's their will. So courtesy between doctors is referred to as medical etiquettes. Suppose you are taking double fees from one of the patient, or from your colleague X or whatever. Is it a punishable act? Answer is no. So I can create a MCQ out of this. Breach of which of the following is non-punishable? So remember, breach of etiquettes is non-punishable. Simply not following the courtesy is non-punishable. Breach means not following the courtesy. But breach of ethics is punishable. Then comes the fifth definition, that is of professional secrecy. What do you mean by professional secrecy? Now, it is written like, it is every doctor's obligation. Obligation मतलब करना है, क्या करना है? We have to maintain, it is our obligation to keep secret all information of a patient which we have come to know during course of treatment of the patient. Patient has shared some private information with you, and you made the patient famous in the hospital that his girlfriend has left him. This is not to be done. If he is at all a depressive person, you can tell the family members that he is into depression. You can disclose the information in a way that it is not harming the patient. So this is called as professional secrecy. What about if you breach the secrecy? Again, this will become unethical. Or the patient can take you to courts for defamation charges that you have defamed him publicly. So professional secrecy is to be maintained. If you breach this secrecy, again, it is a punishable offense. So if you don't maintain the confidentiality of MTPs, it is a punishable offense. It is a punishable offense as per MTP Act, and it is unethical act also. State Medical Council can also take action, disciplinary action. So basically this action of SMC, now we can write SMC has got disciplinary powers. They can take disciplinary action, not judicial action. Because when you will revise your notes now, these words will trouble you. So if they are already there in your notes, it will become very simple. So disciplinary action can be either warning or penal erasure. Now there are certain situations where I will disclose the information of the patient, like the patient was having suicidal tendency. I will tell the wife of the person that your husband is into some depression due to the X. So now I will share this information. This is allowed. And what is this called as? This will be like exception to PS. PS goes with professional secrecy. Exception to PS is called as privileged communication. We doctors are privileged that in certain situation we can communicate about the condition or the information of the patient to certain individuals or to certain authorities. What are those situations where PC can be made? Exceptions to PS is PC. This is the way to revise. Ethics, moral principles. Etiquettes, courtesy. PS is to be maintained. Exception of PS, PC. And your definition will be revised within seconds. Now, what are the important situations of privileged communication? With a mnemonic, let us quickly cover this. This simple mnemonic goes with civic, first of all, where C stands for crime. If a patient has done a crime and you come to know that so-and-so person whom you were treating has done the act of homicide, you will inform the police authorities. I for infectious disease. You will inform the relatives, your colleagues, nursing staff that please take care. V for venereal disease. Patient suffering from any STDs, you inform the partner, at least the partner, to be aware. Otherwise, you will also get the infection. Then I for in patient's interest, like for patient having suicidal tendencies. Any patient with suicidal tendency, we can inform the relatives. And C for court of law. Now patient has filed or their relatives have filed a complaint against the doctor that they are not happy with the doctor's way of treatment. They have taken you to courts. They have tried to penalize the doctor. So in court of law, you can disclose all the information of the patient to prove that you were managing in the correct way and you are totally correct. And after this civic, remember sin. And this will end our definition area, the most basic area from where one question usually is asked. Then S for not one. As far as the MTP Act we have covered. So you will get one or two questions from this simple area. S for servant and employee. A very good example given in Reddy is, there is a train driver who has come for regular eye checkup. They come to railway hospitals now where divisional medical officers are there. After clearing UPSC CMS exams, you are appointed in MCD hospitals, you are appointed in railway hospitals. So their divisional medical officer is there. He is examining a train driver because their regular eyesight is to be noted, is to be monitored. Now during that regular eye checkup, the railway hospital doctor finds that now this train driver is having color blindness. Now the driver is not going to inform the railway authorities that I have become colorblind, please refrain me from my job. मुझे अपना काम मत करने दो, मुझे थोड़े दिन छुट्टी दे दो. Now it is, भले ही ड्राइवर कर भी दे, but it is the duty of the railway hospital doctor to ensure that the railway authorities are informed that so and so person is a train driver and now he is colorblind. So this goes with train servant and employee. Then I for in self-interest, we doctors can disclose all information of a patient. Best example which you can correlate is like negligence cases. Patient is basically this and this is almost the same, but to fulfill the mnemonic they have to be entered like this. Then N comes for notifiable diseases. Important notifiable diseases which we can quote as examples is, any case of yellow fever you need to inform the municipal corporation authorities. Any case of COVID is notified to the municipal corporation authorities because now they will take the public health control measures. If you don't do so, again you are committing an unethical act. So I can say breach of ethics, breach of professional secrecy, and not doing the communication where communication was expected from the doctor is again punishable. Now State Medical Council can take disciplinary action against the doctor in any situation, but breach of etiquettes is non-punishable. Clear till here? So this covers our definition area. कौन से definition of FM, MJ, how you have to revise. जैसे few students are in trouble ना कि sir how to revise. I will tell you a very simple trick. Write these keywords which you have learned right now. Okay, it took me how much time? Around 1 hour. Definition of FM, definition of MJ, definition of medical ethics, etiquettes, professional secrecy, and privileged communication. Now, whatever you have written by your hand, you have to revise. That FM definition, okay, application of medicine law, that can be natural, unnatural, CAD can be natural, unnatural can be accidental, suicidal, homicidal. In accidental, remember fall from height cases. Accidents can be road traffic accidents also, where we will get blunt injuries, abrasions, bruises, laceration plus fractures, and that transmitted force impact injuries if the person lands on feet. With medical jurisprudence, revise your MTP Act 2021 very quickly. Then keywords, ethics is moral principles. Yes, State Medical Council or judicial bodies like courts can take action, judicial action or disciplinary action by respective agencies. For appeals, we go to EMRB, final decision by NMC. Etiquettes, breach of etiquettes is non-punishable. Professional secrecy breach is punishable. If you don't communicate where it is expected, again, it will become unethical act. The work is done. It will take you hardly 5 minutes to 7 minutes in your first revision. And your second or third revision will be done in 2 to 3 minutes. So what you need to do is you need to remove this 1 hour component into hardly 5 minutes max. This is how you should revise. Okay. चल अब आगे बढ़ते हैं. Let us move ahead. Now, in relation to some miscellaneous definitions, they are asked like out of the world questions. तो उनको भी segregate कर लेते हैं. They are actual repeats which have been asked in All India exams or FMJ exams. So, in relation to multiple pregnancy, we will draw one table for all the students who are unaware of this topic. We will devise some criterias to define the terms like twin deliveries. Then we will define another term, that is superfecundation. And the last term which we will write in the last column is superfetation. Fetation. And the criteria which we have to remember is which event of multiple pregnancy means multiple fertilizations, more than one fertilization, mainly seen in females who are under infertility treatment. act of coitus giving rise to multiple fertilization will be single for twins. Single act of coitus fertilizing two ova. This is going to give birth to twins. More than one act of coitus giving rise to two fertilizations. Now these two situations will be there. So here the act of coitus is more than one. Here also it is more than one. Now where lies the difference? The difference is in second criteria, that is which event occur in one menstrual cycle. Obviously, twins is due to single act of sexual intercourse giving rise to two fertilization. The menstrual cycle will be the same menstrual cycle where both the fertilizations have occurred. Superfecundation is also one of the conditions which can be rarely seen in humans. Rarely. I am using the word rarely. Means very rarely in the same menstrual cycle. Normally we have read that after one fertilization, another fertilization is inhibited. But what is superfecundation? In some females who were under infertility treatment and some ovulation agents were being taken by the female, now the female can be fertilized in the same menstrual cycle by another act of coitus. This will give rise to the term called superfecundation because this is not twins. What is fetation? Female has got fertilized. Instead of primary amenorrhea, she is still ovulating, which is impossible in humans. That is why which event is impossible in humans? Superfetation. Where fertilization is happening in another menstrual cycle. So in which of the following conditions there is a possibility that fathers might be different? For twins, the father will be the same father because the act of coitus was due to act of coitus giving rise to fertilization of two ova was single. So the father will be the same father for both the twins. But what about fecundation? Is there any possibility that the father might be different? Yes. Because the act of coitus is more than one. Na? Father might be the neighbor person or any other person. That is a possibility. Father can be same also. So I can write father can be same or different here. And the same thing goes with fetation. Wherever the act of coitus is there, there is a possibility that the father might be different. This was asked in our NEET PG exams. And before NEET PG exams, I used to tell in my classes that this topic will be asked in this format. And it was asked in this format. And the last criteria to be remembered is age of fetus. Now, this is a very common sense thing that age of the fetus will almost be same wherever the fertilizations are happening in same menstrual cycle. So, age of the fetus here will be same. Here also it will be same. But where will the age be highly variable? Where the fertilization is occurring in different menstrual cycle. I hope the terms are now crystal clear. Don't make any mistake from this area. If you remember it like this, you won't make any mistake. How the questions are asked? There is a female who has brought twins in one scenario. In another scenario, she has brought fetuses of different age fetus. Okay. So in relation to twins, how they will frame the question? That on DNA analysis, this male was father of both. So yes, my answer will go with yes, this goes with twins. But if the moment I write the male was the father of one of the twins, what is correct about this situation? By giving the word twins in the exam, the examiner meant to say that they are of same age. Means your answer can be either twins or fecundation. This is how you will approach the question. There is a female who has presented twins. The police gets the DNA analysis of the fetuses and the male. Male is the father of the both. Answer goes with twins. Male is the father of one. What is the correct about this? Superfecundation. Because the age of the fetus is same. The moment the same topic and the lines of the question is, now the male is father of one. Now your answer will go with superfetation. This is how you will approach if you will revise in this manner. You will approach like this. Now in FMG exams, what was asked was, a female has brought two fetuses alleging so and so male to be their father. On DNA analysis, male was not the father of any. Male was not found to be the father of any of the kids. What is correct about this situation? So what are these fetuses now called as? They are called as supposititious child. Another name for supposititious child is fictitious child. So these were the 3 or 4 words which are asked from the definition areas. Fictitious child. So usually sometimes these females with a malified intention, they allege, they steal children from hospitals, from maternity hospitals, they steal newborns and they allege a male to be their father. But on DNA analysis, the male is not the father of any. So what do you call such children as? Fictitious child. And for DNA analysis, which is overall the best sample, you all know, blood. And that blood is taken in which colored vials? Lavender. Lavender colored vials, they contain EDTA. So for DNA analysis, blood is taken in EDTA coated vials, which are lavender color. This one is your EDTA coated vial, lavender color. Then another miscellaneous definition. What was asked in our All India exams was, what do you mean by filicide? Filicide is deliberate killing of one's own child. Deliberate killing of one's own child. Basically is almost synonymous to that term, battered baby syndrome, where the death of a battered child occurs. So you can correlate that with filicide. Filicide is deliberate killing of one's own child. So parents usually they beat their own child and they also cause death of their child while battering them. And what is the most common cause of death in battered baby syndrome? Anyone? What is the most common cause of death in battered baby syndrome? Most common cause of death in battered baby syndrome is subdural hemorrhage, which occurs due to rupture of bridging cortical veins caused by that vigorous shaking of the child, and that is why battered baby syndrome is also called a shaken baby syndrome, details of which we will write in our injuries chapter. Now come to the legal procedure aspect. Before legal procedures aspect, so there we will have to cover some important terms. Let me write those terms in one place. So this covers our basic definition areas. These terms are the term called evidence. Then we have to cover few lines about different types of inquest and all. What are the different types of witnesses? And what are the different types of courts and their procedures and powers? So these are the 4 areas which every medico should be aware of, be it FMG exams, be it PG exams. So you should revise this also like a story. Okay, the story which we will be covering in this format only. So before going into the details of each and every word which we have written, let us cover one story of state versus accused. So let us take one accused who has done a crime against the state. Every crime is a crime against the state. And in Indian legal system, our Indian legal system is an adversarial system which says an accused is innocent unless proven guilty. Unless proven guilty. Who needs to prove the guilt of the accused? The person whosoever is saying that so and so person is the accused. He has done a crime. So normally this is what is called as burden of proof. also called as onus of proof. Onus of proof. In our exams, what has been asked is burden of proof or onus of proof normally lies on whom? Normally lies on the victim side. What is this burden? They have the burden that they will have to prove the guilt of the accused because they are alleging that accused has done a crime. Because court's stand will be accused is innocent unless proven guilty. Who will prove the guilt? The victim side, being represented as state, because every crime is a crime against the state. Or I can write here the word victim. So burden of proof according to normal Indian legal system lies on the victim side. This thing is very clear. Now come to a story. The story of this state versus accused. This accused has done a crime of killing his own wife, suppose. Okay. He has killed his own wife, and after killing his wife, he tried to play with the evidences. He tried to mislead the findings. So basically, this is a story of one of the persons who killed his own wife with a heavy sharp-edged weapon, that is axe. After killing his wife on third floor, he brought the dead body through the stairs to ground floor and kept the dead body corresponding to the balcony of the house. The balcony of third floor. What he should have actually done, if he was to create a picture of fall from height, he should have actually done that. But his mind was not in a stable condition, so he brought the dead body through the stairs. He removed all the blood stains with water and detergent with a view that all the blood stains will be gone, but still traces will be there. To remove all the blood stains, what he should have used? Glycerine solution. Glycerine is a blood dissolving agent. All of your knowledge is increasing. Forensic is knowledge enhancer subject. Your day-to-day knowledge will also be increased. So now let us come back. So now he has done the crime. He has brought the dead body to ground floor, and now he calls Delhi police that please come and save me. My wife has fallen from third floor. So what the wife should have actually shown if she was a case of fall from height? Multiple injuries, lots of fractures. Okay. Clothes will also be seen to be torn or ill-mannered. Everything will, there should be lots of injuries now over the body part. The moment by chance I was on duty, I saw the inquest papers. While before starting autopsy, we identify the dead body. So while identification, the policeman is there, the accused is there. He called his brother to identify the dead body. So now they were identifying the dead body. I saw the dead body. I saw the papers that police has written a history that the female has fallen from third floor. The moment I saw that 3 big chop wounds caused by a heavy sharp-edged weapon were there over right side of the head, I told the SI that this is not a case of fall from height. Please call your seniors. This is a homicidal case. This is not a fall from height case. Based on my injuries knowledge, this is FM, application of medical science knowledge in law. So now the person who has given the history is telling a lie, and the policeman became very happy that I have caught the accused, because the accused was standing besides the policeman with a view that no one will catch him. But finally he was caught. So the essence of this story is, while he was killing his wife, suppose there was a neighbor who has seen this act. उस neighbor ने ये act को देख लिया. In law, ऐसे witnesses को क्या बोलते हैं? Common witness. Any person who has seen the crime occurring is called as common witness or eyewitness of the case. Who is a common witness? A person who has seen the crime occurring. Which knowledge he will have in his mind? Our questions of all India exams. First-hand knowledge. Which type of witness will have first-hand knowledge? Common witness. What is common witness? Eyewitness of the case. Which type of evidence he has acquired while he has seen the crime? He has seen something directly related to the crime. This is called as direct evidence. Now, when the body was brought for autopsy, with my expertise, I saw the chop wounds. I noted them in my autopsy report. A case of accidental death was actually a homicidal death case. So it was later on the FIR. In the FIR, the sections were changed. I have become expert witness of the case because whatever I have written will be admissible in our Indian courts. So I become expert witness of the case. With my expertise, I have written those findings. I have also gathered something directly related to the crime. So direct evidence is acquired in law by which witnesses? Common witness, expert witness. There are few witnesses who will acquire some other type of evidences. Those will be indirectly related to the crime, and they are called indirect evidences. Indirect evidences can be of two broad types. We'll be writing all these things in a flowchart manner after this story. So indirect evidences can be circumstantial, can be hearsay. Circumstantial evidences are something which has been seen in relation to a crime. Something has been seen in relation to a crime. Like in the same story, if there was a neighbor who has seen this accused bringing the dead body through the stairs and then calling the police and telling that my wife has fallen from third floor. So he has seen something in relation to a crime, a very valid evidence. This will be admissible in the courts, that you have seen this accused playing with the evidences. Okay, he was trying to mislead the findings. So all this will be admissible in the courts, called as indirect evidence, to be exact, circumstantial. There can be something which has been heard by a neighbor while the killing was being done by the husband. There was one neighbor who has heard this altercation between husband and wife. So he comes to the courts and tells that I have heard something from the victim. Now, routinely, these heard things in law is called hearsay evidence. Routinely, they are inadmissible unless you have heard something from the victim around the time of death, because no one speaks lie. कोई झूठ नहीं बोलता डेथ के समय. No one speaks lie at the time of death. That is the court's stand. So let us make a flowchart for this story. So in this flowchart, in the center, I will write this word evidence, and I will divide it into two broad categories. Evidence acquired by public witness, which in legal proceedings is referred to as PW. We all are PWs. PWs will consist of common witness, expert witness. ये देख के डरना नहीं है कि ये कौन सा विटनेस है. Public witness is general public. So evidence can be acquired by public witness outside courts. And based on this mechanism, evidences are classified into direct evidence, E for evidence, and indirect evidence, which has been acquired by public witnesses. Indirect evidence. So this is one way of classifying the types of evidences. Another way of classifying is evidence inside courts, which we will see after some time. So let us first focus towards outside courts. What is happening? So direct evidence can be acquired by, we know, number one, common witness of the case. Now I will write the word W. W for witness, also called as eyewitness of the case. Any person can be a common witness. Who is a common witness? A person who has seen the crime occurring. So this keyword should be remembered. A person who has seen the crime occurring. Not the facts related to the crime, but the actual crime occurring. And they will always have, repeat all India question, which type of witness has got first-hand knowledge about the crime? So you know it is the common witness who has got first-hand knowledge about the crime. Then direct evidence can also be acquired by another witness, that is expert witness of the case. Any witness whose findings in relation to a case is admissible in the courts, they become expert witness for those findings. Which type of evidence they have written in their findings? Direct evidence. It is directly going with the crime. Indirect evidences, on the other hand, can be broadly categorized into circumstantial and court's stand is circumstantial things will be admissible If a person is saying S of circumstantial will help you, I have seen something in relation to a crime, it will be admissible that yes, whatever you are saying that he was bringing, because it will be correlated with the case findings na, that lots of blood stains were there over the stairs, so it will be admissible. But if a witness says plainly that I have heard something, that these two couples were fighting, normally the courts will inadmit. Hearsay says it will be inadmissible. But then the witness says, I have heard them fighting, and then the female crying and saying that my husband is going to kill me. At around 12 o'clock in the night, she was dead. I was doing autopsy next day morning, 12 o'clock. Okay, 12 p.m. With respect to the documents, the time since death comes out as 12 hours. What I wrote in my autopsy report was rigor mortis was in a developing phase and it could be elicited in all the body muscles in a developing phase. What I mean to say, initial 12 hours have passed, because in the initial 12 hours, rigor mortis is going to start from eyelids and it will go involve my fingers and toes muscles too. The first muscles to show rigor mortis will be heart muscles for undefined regions. So my post-mortem findings again will correlate with the version of the witness. Now his version will be admissible. So hearsay, when does hearsay become admissible? Routinely it is inadmissible, but if something has been heard by a public witness at the time of death, at the time or around the time of death, means the same, around the time of death. What all things can be heard? So legally speaking, one thing can be dying declaration made by a dying person. The dying person told the doctor or the magistrate or any person that I want to tell you something. My husband has killed me. This is the statement of a dying person. Why it is admissible? You have heard this fact now, but why courts say the dying declaration is admissible? Because it was heard at the time of death of the victim. Okay. And that is why we say na, if the after giving dying declaration, if the victim survives, what happens to dying declaration? It becomes inadmissible. Because now the victim will be called inside courts and the procedures will happen inside courts. The victim will now become a public witness, himself or herself. Okay. So in this situation, the victim will be herself. So she will be called inside courts. How she will be called, what will happen to that witness, we will see later. So let us first focus here. If something has been heard at the time of death from the victim, that can be a voluntary statement. The victim voluntarily told the doctor that I want to tell you something. This is a voluntary statement of a dying person called as dying declaration. Then there can be something like the neighbor coming and saying, I have heard this female crying and saying that my husband is going to kill me. And the time since death correlation was easily done. But the victim did not target the neighbor, that neighbor, please listen, I want to tell you this thing. This was an involuntary statement out of fear of death. So this involuntary statement is also admissible. So voluntary and involuntary statements both are admissible if heard at the time of death. Only they are called in a different way. The voluntary statements of a dying person called as dying declaration. The involuntary statements of a dying person called as res gestae. I hope the division of evidences is clear outside courts. Now, when all these public witnesses will be called inside courts, how will courts call them? How will they come to courts? After receiving summons. So it is the courts which will issue summon. And what is summon? A legal order compelling a witness that you have to come to courts on a particular date at a particular time to record your evidence. So the judge will issue summon to all the witnesses of different parties, the two parties being victim party, accused party. So the victim party and the accused party, they will have their lawyers also, because it is the lawyers who will fight their case inside the courtroom. So inside court, once the witness comes inside court, the situation will be the judge will be in the center, And this judge, on the two sides, will see that one is the victim side, another is the accused side. And the victim side is usually represented by a government lawyer, Sarkari Vakil, called as public prosecutor. They receive their salary from the courts itself. They are on a salaried basis. Accused will have to hire a private defense lawyer. But suppose the accused was a poor person and he tells the judge, I don't have any money to hire a defense lawyer. Now the courts will give him a lawyer too. He will also be given a lawyer from the court side. But usually these defense lawyers, they have to be privately hired. But he will have to prove that he is so poor, he has no money to hire a defense lawyer. Then the courts will provide him a defense lawyer too. But usually the lawyer is provided from the court side to victim side. So that lawyer is called public prosecutor. Now the judge has issued summon to witnesses. The different types of witnesses belonging to victim side or accused side, they will come to court on their respective date and time. Suppose I have also received a summon that you have to come to Karkarduma Courts, Delhi at 2 p.m. on so and so date. Suppose I go to the courts. Now what will the judge ask me, or the judge will tell me, Doctor sir, please take oath. Oath is to be taken. Before giving your recording or evidence, oath is to be taken. After taking oath, now what will start is oral. With my mouth, I will tell the courtroom that this is the autopsy report which I have prepared after conducting autopsy on the dead body of so and so person. So my oral evidence recording is going to start. In another way, this oral evidence recording is called as examination of witness. Examination of witness. An oral evidence recording or examination of the witness can be of three types. The lawyer who has called me will be the lawyer of the victim side, that is public prosecutor. He will have all the rights to examine or record my evidence first. And that type of examination is called direct examination of the witness or examination in chief. By the word recording, always remember there is no video recording of our evidence being given in the courts. Oral evidence recording means whatever I will tell the courts, there will be a person who will type all the things they are very quick. So whatever we say, they type very quickly except some medical terms like antemortem, like hemorrhage. So there we tell the spelling also. So I have told everything to the person. He will type it very quickly. Everything will come out on court's paper in a printed format. I will have a look over that and then I will sign it. I have prepared an autopsy report after signing. That is admissible. Those findings are admissible. Once I come inside the court and tell the same findings to the judge in front of the lawyers and in front of the accused, now my evidence of post-mortem report is admissible in the courts. This type of examination will be called as direct examination. So my oral evidence has been recorded in a documentary form now. Now that document is admissible. That is why we read now there are certain exceptions to oral evidence, like dying declaration, evidence recorded by a witness in lower courts is admissible in higher courts, then report by certain government scientific experts. But which people are not included in that exception list? We doctors. Whatever reports are made by doctors, like medical legal reports like MLCs or examination of sexual assault victim or autopsy reports, the doctors have to go to courts to prove that they have done this. So, which is not an exception of oral evidence? Report by any doctors. Always remember this. So, we doctors have to go to courts to record our evidence, which we have gathered in the form of findings. So, this type of examination will be called direct examination. I will let the courts know the gist format of my autopsy findings. Then the opposite side lawyer will become super active. And what is his intention? His intention is to prove that Dr. Vishwajeet Singh does not know anything about FMT subject. He is giving biased findings in his autopsy report. This was a case of fall from height and the person can get chop wound in fall from height case. Now what will happen? You all know what will happen? reversal of law will happen. And this type of examination where the lawyer tries to prove that witness is inaccurate, biased, he is giving misleading findings. He is not true, but he is telling this or he is trying to prove this. This is called cross examination. So cross examination is always done by opposite lawyer. Opposite lawyer. Which type of lawyer does direct examination? The lawyer who has called their witnesses. This is done by lawyer who calls the witness after telling the judge that I want to call so and so witness to the courtroom. Done by the lawyer who calls the witness. So in my story, I will be called by public prosecutor. He will do my direct examination. Cross will be done by the lawyer of the accused. And during this cross examination, two MCQs, pet MCQs are there. What are those pet MCQs? You all are aware. There is no time limit for which part of examination of a witness. Answer is cross. Another pet MCQ is, in which part of examination of the witness leading questions are normally allowed? Leading questions are normally allowed during cross examination. What are leading questions? Leading questions are questions which are answerable in yes or no manner. Any question which is answerable in yes or no manner is called as leading question. Have you seen the crime occurring? The witness says yes. This type of question is allowed in which part of examination? Cross. Then third type of examination which is rarely needed is redirect. Redirect simply means this direct examination is being done again. So called as redirect. So this one is rarely needed if a witness is trapped in leading questions and all. So now the first lawyer will try to clarify those facts. And last thing to remember is, what do you mean by court questions? So always remember, court questions means questions asked by judge at any time of judicial proceeding. Judge is the supreme authority now. The honorable judge is the supreme authority in the judicial courts. So question can be asked by judge at any time of judicial proceeding. Be it direct, be it cross. Judge can ask questions from the witnesses at any time of judicial proceeding. So what are court questions? You know, questions asked by judge. And you very well now know the term oral evidence recording. A witness has been asked to come to court and record their evidence. Which type of evidence will be recorded? Oral evidence. A witness has been ordered by the court to come and record their evidence. What is correct about this order? उस order को क्या बोलते हैं? उस order को summon बोलते हैं. These are two questions back to back of FMG exams. So what was the question? A witness has been ordered by court to come and record their evidence. One way of framing the question was, in one of the sessions was, what is correct about this? What is correct about this? What is correct about this? So basically, if the question ends at the word evidence and the witness has been called to the court, what is correct about this? The best answer will go with oral evidence. The witness will record their oral evidence. If the twist of the question is like, which was actually done in one of the session was, what is correct about this order? Now they are particularly asking you, what is this order called as? So we know this order is called as summon. What is summon? Also called as subpoena. A legal document where the name of the witness is written, a particular, I will show you some important examples of summons just after the break. And we will be covering our types of courts, type of courtroom procedure. We have already covered types of courts, the powers of courts and all that. So there I will cover many more MCQs as well as the different types of summons and all. I hope you got the question now. So they were very tricky questions, these two different questions. So we can take a short tea break and we can start after 20 minutes. So right now it's 6:05. So we will start around 6:25 or let us start 6:30. And we will cover rest of the part of the legal procedures. Then we will cover our sexual jurisprudence topic, the sexual assault victim and all. And thereafter we will go with negligence topic and all. So see you all at 6:30. Bye bye. And gather your queries. For any queries na, in the end part of today's session, I'll be taking all your queries and it will be certified today itself. Chalo.